Hi, and welcome back to another edition of Casual Conversations. My name is Brennan DeBose, social media producer for Columbia University Surgery Page. So, we have a celebrity here with us. We have a celebrity here with us. Her name is Dr. Marissa Boeck, and she is a doctor here at Columbia University Medical Center. How are you doing today?
I'm good.
I'm so happy to have you. You're a very busy person, and we are I'm super excited to speak with you. I'm super excited to speak with you. It's been a while, but I feel like I earned this, so I'm super excited to have you here. So I just want to dive.
Residency life.
Residency life. So I want to just dive right in. My first question is, what first interested you in becoming a doctor?
So going back to high school, I got involved in the sports medicine track that we had at our high school, which was pretty unique, where you got to be a sports athletic trainer and travel around with the different sports teams. And so through doing that, I really became fascinated with the human body, anatomy, how things work, and what happens when they stop working the way they should. And so I actually thought I was initially going to go into sports medicine and thought I would pursue something like being an athletic trainer for a professional team. But then things kind of took a different course, but that's basically how I got interested in medicine, was just through being exposed to it in school.
And you're a surgeon. So what made you kind of go the surgery route?
Yeah, so I started med school, and in between my first and second year, I did research with a breast cancer oncologist, but she was doing a project also with some surgeons as well, and so I got to pop into the OR, and it just always fascinated me how the OR felt and what they could do in there. And so then after that experience, plus an experience I'd had earlier in college where I was down at Bellevue and I was in their ER and their OR and got to be with some trauma surgeons there and who were just the coolest people doing the most amazing work. Surgery had already been planted in my brain, and then after we do clerkships in our third year of med school, I really got hooked on it, and it's something where the immediacy usually of the treatments that you can provide to them I really like, and the fact that you can usually help anybody that comes across your path. You're not ever feeling, if they need a procedure or a bigger surgery or something, you're usually able to intervene and fix whatever's going on, hopefully.
Hopefully, absolutely. So what is your specific practice?
So right now I'm a fifth-year surgery resident, clinical fifth year, but seventh year total since med school. We take sometimes 2 years off to do research in the middle, and so I went and did an MPH at Hopkins and then did some work in Bolivia since I'm interested in global surgery. And so
Do you speak Spanish?
I do. Hablo español.
Okay. All right.
I know. That's the only one, though. No other languages. And so I am finishing up my clinical training and my residency, and then I'll finish that in June. And actually, I just found out I'll be going to UCSF for a trauma critical care fellowship.
Congratulations.
Thank you.
Congratulations.
Thank you. I'm so
excited.
Just
on a roll. On a roll.
I've had a lot of good opportunities and
gosh.
met the right people and, worked hard.
Absolutely.
Obviously,
Absolutely. A lot of hard work.
Yeah.
A lot of hard work. A lot of sleepless nights, I'm sure.
We do 24 to 30-hour calls,
Yeah.
That would be a sleepless night.
Yeah, I think that will call for it. My last question for you is, what is the most rewarding part of your job?
There are a lot of parts that make it worthwhile and that make time kind of stand still, so to speak. And you'll find when you're in the operating room, you've been in there for potentially 6 hours, but it felt like 5 minutes. And I think overall what it is the patients and the impact that you can have on their lives, what really keeps me going, and how much faith and trust they put in you and in your hands to be able to take care of them and fix whatever is hurting them at that moment. And then besides all of that, I find it's rewarding to be able to contribute to research in different fields and try to understand things a little bit more. Also in my academic life about trying to build surgical systems and trauma systems in lower resource settings. I find that really fantastic because it allows us to take things that we've learned that work here in a more developed setting and try to take them somewhere else that maybe has fewer resources, but try to make it work with what they do have in order to save lives and improve care.
Dr. Marissa Boeck, I'm so happy I got to speak with you. This has been absolutely a pleasure. Thank you so much for being with us.
you.